So some of you will be familiar with ICPerMed already, and apologies to any of you who are already familiar with it, but perhaps some of you may not be so familiar. And so we just wanted to let you know what we are, what we do, and what our kind of aims and objectives are. So sorry, I now have to go backwards. Right. So I put this slide up, but in fact it's already been mentioned, so I'm not going to dwell on it, but it's the working definition of personalised medicine that we use. And in fact, Wolfgang Burtscher already mentioned this. And of course, this is the definition according to the European Council conclusions back in 2015. This is I won't read it, you can see what it is. But this is our definition for the purposes of ICPerMed of personalised medicine. Now, the context for personalised medicine, again, a number of people, I suppose, have mentioned some of these points, and you'll be familiar with them, and this is not, in any sense, an exhaustive list. But what's happening at the moment, we've already had mention and a very nice description of what's going on in terms of the digital revolution that's happening in health. So there's a lot of technology drivers here. There's a different approach to healthcare. I think where the starting point is not so much the disease, but the patient with all their individual characteristics. We have question marks in every country, I think, about the sustainability of our healthcare system. There isn't a country going, I think, that isn't concerned about costs and, worried about containing costs. So a constant drive towards better use of resources. And we do have increasingly complex health and social care systems. Of course, the societal expectations. People's expectations are changing. It's a very good thing that they are. We have more informed and engaged patients. And they have, I suppose, an expectation of improved health quality of life. And so what all of this means is that personalised medicine offers opportunities, I suppose, for patients, healthcare providers, payers, and indeed for industry. It also offers, or maybe has certain challenges as well, but we certainly are very focused on the opportunities. So again, I think some of the previous speakers have mentioned some of these milestones that led up to the establishment of personalised medicine. And I mentioned earlier, and I think others did, the funding that has gone into personalised medicine activities and projects at European level. But there are also a number of policy milestones as well, which are quite important. So back in 2010, the European Commission organised a number of workshops, which we largely were focused on omics-related research, proteomics, genomics, etc. There was then a conference on European perspectives in personalised medicine, again organised by the European Commission. In 2011, with the establishment of EuroBioForum, which was a 4-year project, again, which was a platform for funders and performers. In 2013, very significantly, there was a CSA funded called PerMed, and the purpose really of that was to develop a strategic research agenda for personalised medicine, and that was published in 2015. And then that was followed in June 2016 by a personalised medicine conference that was organised jointly by the European Commission and representatives of member states. So they're the sort of key policy milestones, and you can see all the way through that the European Commission has been very supportive of this whole area. But I suppose arising out of all of that, and particularly with the strategic research agenda in personalised medicine, the question was, well, how do you actually implement that? So you have a strategy, you have something that sits on the shelf. We've all got lots of strategies sitting on our shelves in our offices, I'm sure. But how do you actually take it then to the next stage? And what do you do to try and actually implement that? And so it was agreed that we needed some kind of a mechanism across member states driven, something that crossed boundaries, that cross different countries. We needed a mechanism to support coordination. So to support coordination efforts, we wanted to avoid overlaps, to look at ways of actually implementing those policy recommendations. And we needed a mechanism to support collaboration. And we needed a mechanism to create synergies between all the different funders, because funders are doing all sorts of work in this area, but how to come together. So hence, ICPerMed was then established in November 2016. And the overall aim of ICPerMed was then, and still is, to coordinate and foster research to develop and evaluate personalised medicine approaches. So ICPerMed itself does not have a pot of funding, but of course all of the members do have funding at their disposal, and we are trying to adopt a more coordinated approach in the way that we utilise that funding. So we have more than 35 European and international partners. It goes beyond the European Union countries. We have a number of other partners as well. It represents ministries, funding agencies, and we also have representation in ICPerMed from the European Commission. And we follow an international consortium model. So any of you maybe who are familiar with perhaps the Rare Diseases Consortium, it follows a similar sort of a model to that. And what that means is that we identify common strategic goals. We aim to align our research funding, and we aim as much as we can to share results, data, standards, and examples of best practice so that we can all learn from each other. So that's the model that we follow. So our vision statement then, and you can read it, it's to try and establish Europe as a global leader in personalised medicine research. We want to support the personalised medicine research, the science base, by having that coordinated approach that I mentioned. We want to look at the benefits, support research into the benefits of personalised medicine research for citizens and healthcare systems, and that's very important. And ultimately, we want to pave the way for personalised medicine approaches for all citizens. And it's all focused on research as a driver of personalised medicine. So a very quick slide in our governance, and I know people can, sometimes these governance slides can be a little dull, but it's important just to know how we're organised. We have an executive committee where there is a representative from all of our members, so as I say, about over 35 members at the moment, and then from within that we have a steering board, and that is made up of a chair and 2 vice chairs. We have various group leads, we have representation from the European Commission, and of course we are supported by the Secretariat, and the Secretariat themselves are funded through Horizon 2020 as a coordination and support action. We also have a stakeholder group, so these are people who are not members of ICPerMed as such. Perhaps they're not funders or not public funders, but they want to keep in touch, and so this is a wider group and a way for us to keep in touch with the wider community. And then underpinning that, we have a number of challenge groups, I'll mention those in a minute, and action item groups. So this is really just the way we are organised to try and to organise our working programme. So mentioning there the challenge groups, when the PerMed developed their strategic research agenda for personalised medicine research back in 2015, they relied very much on the concept of 5 challenge groups, and we've just set them out here. We carry this through into the ICPerMed structure, and these are groups made up of both funders and experts in the field. And so you have the first challenge group there was very much focused on research or relevant to citizens and patients, so that involved patient groups, industry, as well as funders and policymakers. The second group very focused there on data and ICT. The third one around research efforts. The fourth one was around market access, and the fifth one was around health systems. So these challenge groups spanned the whole healthcare chain from the patients right through to the healthcare systems and market access. And we have continued with that, using the expertise that we have in those challenge groups to help inform our own work in ICPerMed. So again, briefly, what have we achieved so far? We're 2 years old. The first thing we did, and it was mentioned earlier, was to develop an action plan. We had the strategy, we had the strategic research agenda from PerMed, but to take that to the next level and actually to turn that into actionable topics that we could implement. So we set about developing our action plan, which is really basically a work programme for ICPerMed. We, as I say, based it on the PerMed strategic research agenda. We used the challenge groups as our access to experts to advise us. We were informed also by that Personalised Medicine Conference that I mentioned that the Commission organised in 2016, and of course that then went through our own executive committee, and that was resulted in our action plan, which was published in 2017, and that identifies actionable research and support activities. And what we're using that for now is to inform the strategy of research funders at national and European level, and it's already been mentioned that the actions that are in that action plan are being used to inform maybe topic calls through the IRANet, the PerMed IRANet, or topic calls in other Horizon 2020 initiatives. And we are aiming to use it at national level within our own funding strategies as well. So it's organised in two parts, A and B. We have research actions, but we also have policy and support actions as well, because so much of the implementation of personalised medicine, actually, it's not just the research, it's also the policy activities, it's the training, it's the education, it's patient engagement, it's about use of data and so on, ethical issues, societal issues. So it's much, much broader than just the research. And as I mentioned when I showed you there our governance structure, we implement that through 5 sort of subgroups, and you can see that they, to some extent, map onto the challenge groups. Okay, so that's the first thing we did. We published our action plan in March 2017. The second thing we developed was a partnering tool, and this is available on the ICPerMed website. And what this is, it's a platform for research organisations and individuals to find potential cooperation partners. And again, that has been used in various calls by people who want to find, who's doing what, can I partner with somebody? Has somebody got expertise in a particular area? And we have 250 entries so far in that, and that is growing all the time. So we think that's a very useful tool for the research community. The third thing we have done is carried out a survey and put in place a database, which is really a mapping activity to look at funding, what is going on in personalised medicine research across Europe. I'm not going to say very much about this at this stage, because one of our colleagues on the executive committee will be talking about that specifically later on. So I will leave it to Monica to tell you all about that. But again, that is the results of that are available on the ICPerMed website. And we will be adding to that all the time so that we have a good map of what's going on. The fourth thing is around, I mentioned again, to try and coordinate our approach to things. So ICPerMed is a forum. It's a forum that allows us to coordinate our response to things that are going on, to come to an agreed position. And so we've also decided that we will agree positions or issue joint statements on issues that are important in personalised medicine. And the first of those was issued in May this year on the 1 million genome declaration. That was one of the things that came out from DG Connect. And there will be, I'm sure, more to follow. We every year publish a state-of-the-art report. Again, that's available on our website. The first year was mainly focused, it was published in earlier this year, and it looked at 2017. It was mainly a report on ICPerMed activities for that first year, but we expect future reports as well, which will offer a more general overview of the field of personalised medicine. We've also decided to put in place a recognition of best practice. So we want to recognise and celebrate best practice in personalised medicine. And the first of those recognition awards will be announced at the conference tomorrow, I think. And we're also announcing the launch of a call for the 2019 nominees, and that will also open tomorrow. And the last thing there I wanted to mention were our ICPerMed events. So we run a number of events. We had our first workshop in Milan last year, which was focused on data generation. So it was very much focused on the use of data in personalised medicine research. We have, of course, our conference today and tomorrow. Next year we will have a workshop looking at personalised medicine in the context of sustainable healthcare systems, and we will have our second conference then in 2020, and the theme of that to be decided. So coming up in 2019, as I say, we'll have the launch of the call for the 2019 Recognition Award. We are also publishing a vision statement. We're working on that at the moment. That's supported by a survey of 70 experts across Europe, and I think many of you may be in the audience, and I want to thank you for your contribution to that. It's been very, very useful. We're just putting together at the moment the results of that survey, and that will be published as a vision statement in spring 2019. I mentioned already the second workshop we'll have, which will be focused on sustainable health systems. That'll be this time next year. And of course, we will continue to collaborate with relevant initiatives. There's so much going on in this space, and it's really important that we try and work together and make sure that we work in a synergistic way. And we will continue to implement the action plan. So that's a quick overview of what we're doing with ICPerMed. I just wanted to very briefly mention, of course, now we're all here today and tomorrow for our conference. We're very focused, as I mentioned in my introduction, on best practice examples. And just in case you're wondering how we came up with those examples, they were selected by the Executive Committee. We asked everybody to go back to their community, to go back to their country, to their researchers, and to put forward, to nominate examples of best practice from their own country, from member states. And people voted on that. So the best practice examples that you're going to hear about today and tomorrow were voted by the Executive Committee as the ones that we thought you would be most interested to hear about, and were very nice examples of personalised medicine being translated into added value. And of course, we have ones that are focused on research and implementation, and we also have ones that are focused on policy. And of course, I also mentioned that we will have a number of keynote talks as well on the different aspects of personalised medicine to give us a broader perspective on various issues. So that's a little run through ICPerMed, just so you know who we are, what we're doing, and what our plans are for the future. So thank you very much for your attention for that.